So for the respiratory system, we are already talked about cardiovascular system in significant detail, right? That was part of your exam from last week. And we also talked about the fact that your respiratory system works very closely with your cardiovascular system. So today our focus is going to be basically on both macroscopic and microscopic anatomy of the respiratory system, the path the air takes through your respiratory system, and how it is exactly working with your cardiovascular system to supply the oxygen and remove the carbon dioxide during the process of inhalation and exhalation. The information that I'm going to give you for inhalation and exhalation is pretty basic. You will go over much more detail for that in your physiology class if you decide to take that class. So again, looking at the functions of the respiratory system, of course, gas exchange would be the biggest function. So we're already familiar with the fact that the good gas, and I put that in quote, for us is oxygen. And the bad gas, again, quote unquote, or waste gas for us is carbon dioxide. So we would need to have a very effective system to allow as much of this gas exchange to take place. And the best way for us to do so is by having a really high surface area. We talked about surface area last time when we were, or two lectures ago, when we were talking about blood and how blood has that kind of concave shape that increases the surface area and help with the effective gas exchange within our body. Lungs also have that. You have a huge surface area, and I'll give you a number later on, that shows how important the larger the surface area it is for us to be able to effectively exchange our oxygen and carbon dioxide with our respiratory system. Another function of the respiratory system is ventilation, which is basically your breathing. So as you all know, inhalation and exhalation are the two steps. And again, the goal is to supply your body with oxygen and remove the carbon dioxide. As part of your respiratory system, you also have what we call the larynx, or the voice box, that contain two vocal cords. And we'll take a look at this in a little bit more detail. And that's basically important for the ability to vocalize, create sound. And then one that I don't really go into detail for you guys, again, it's heavily physiology related, is that by the help of your respiration, which is basically inhalation and exhalation, you can actually regulate what happens inside your body. And one of the biggest things that you can control is your blood pH. So we already know that your blood pH, the magic number that we always try to reach, is between 7.35 and 7.45, which is a slightly basic. But by increasing or decreasing your heart rate, you can, not heart rate, right, your respiration, I apologize, you can make your blood more acidic or more basic. And that's why if you have seen people who may be hyperventilating, go like, right, because they're either stressed or they are dealing with some sort of trauma, or people who might be hypoventilating, as in their respiration rate might be really low. Both of these individuals are at risk of basically passing out. And one of the main reasons for that would be that that hypo or hyperventilation can lead to a significant change in your blood pH, and as a result can basically cause significant changes internally. And if it's not controlled, it can lead to basically coma and eventual death. Is there any question, guys? As always, please type your questions as I go over the information if you do have questions, so we can answer them as we go. Okay. Some of the main respiratory organs that we have include your nose, your nasal cavity, which is basically the space right behind your nose. The pharynx, which a lot of us, we know it as your throat. However, as we discussed it in this lecture, you'll notice that pharynx is actually broken down to 3 separate parts. We have larynx, which is not listed in your side and your notes here, because a lot of people consider it not necessarily as part of the respiratory system. However, it is in the path. So larynx is basically, again, your vocal cords or your voice box. Your windpipe, which is this tube you see right here, also known as the trachea. And then trachea is going to branch to form these continuous branching you see inside your lungs, called the bronchial tree or respiratory tree. So we'll talk about the individual branching of what you will see basically in your respiratory system or your respiratory tree as we go through the lecture also. Of course, lungs is a big part where your bronchial tree is located inside of. And then lastly, you have these air pockets, which is basically where your gas exchange takes place. And those are called alveoli, if you're talking about all of them. And if you're talking about a single one, they're called alveolus. So removing the I and replacing it with an OUS. Now, if you take a look at your respiratory system, we have what we call a conducting zone and a respiratory zone. So conducting zone is basically showing you the path of the air as it goes through your respiratory system to get to its final destination. So that's the conducting zone. And then you have the respiratory zone, which is basically the part of the system that is going to be essential for the process of gas exchange. So that's the main difference. Conducting, all it's doing is passing the air through the respiratory system. The respiratory zone is where you're actually going to see the gas exchange taking place. You might have heard of another vocabulary if you're looking at medical conditions associated with the system, called upper respiratory versus lower respiratory system. So upper respiratory system is basically anything that's associated with your larynx and above. So your nose, your nasal cavity, your pharynx, your tonsils, your larynx, etc. And lower respiratory system is basically, think about more internally. So it's your trachea, your bronchial tree, your lungs. So when somebody says they have lower respiratory infection, they typically are talking about your bronchi and your lungs. Very similar to what we've seen for COVID, right? So COVID patients are basically have what we call lower respiratory system infection, which affects the lungs as well as the lungs itself, basically, the lung tissue. And again, guys, if you have questions, please type them in. This is one of my favorite pictures for your exam, guys. So when you guys are studying, like all of your other exams, you will have images that are associated with identification of structures. So this is one of the ones that have some of the details, not all of the details. And I'll show you another one with a little bit more detail in just a minute. So again, you have your nose, your nasal cavity. Going behind your nasal cavity, you have your pharynx, which is actually divided to 3 parts. Larynx, which is your vocal cords or your voice box. Trachea, and then trachea is branching to the bronchial tree that you see. Another muscle that you guys can see clearly in this picture is this dome-shaped muscle we have mentioned a couple times previously. That muscle is the diaphragm, and diaphragm is considered as part of your respiratory system, and it helps with the expansion of the lung during the process of inhalation. And again, we'll take a look at this as we go through the lecture. So let's go ahead and start looking at each of the organs of the respiratory system and learn a little bit more about each of them. So we're going to start with your nose. So first of all, your nose actually has two major parts. So you have the bony part of your nose, which is basically called the nasal bones. The two identical bones that are found right up here. So if you ever had a broken nose, you know exactly where that bone is located. The lower portion of your nose is actually mostly cartilage and dense fibrous connective tissue. So what you see basically in blue and white are connective tissue like your hyaline cartilage, as well as dense irregular connective tissue. So when we're looking at the nose, you notice that there is a lot of basically terminology here on the side. I don't expect you guys to be able to name each of the cartilages on the nose. That's a little bit beyond the scope, unless you want to become a plastic surgeon or look more into details with the, as an ENT doctor. So we don't need to know that detail for us. What I do want you to know for nose is that nose and nasal cavity together carry three main functions. And these are the functions that I want you guys to know. So they first moisten the air. So that's one of the functions they have. So basically what you do is you're adding water molecules as the air moves into your respiratory system. So it's not dry, which can possibly cause damage to your lung tissue. You warm up the air, which is also important because, again, internal body temperature is always maintained at 37 degrees or 98.6 degrees Fahrenheit. So you don't want the air, a really cold air, to reach your lungs because it can cause tissue damage. So you warm up the air. And then lastly, which is the most common one people think about, is filtering the inhaled air. So you basically, what you're doing is you're removing all of the particles or dust as much as you can as the air enters through your nose. And that's why there is a kind of a rule that, or you try as a human to always breathe through your nose, not through your mouth, right? Because mouth doesn't have those capacities or capabilities. So you want to make sure you breathe through your nose. And I know some people have difficulty because of their sinuses, because of the structure of the nasal bone, that makes it difficult to breathe through the nose. And a lot of people actually breathe through their mouth more than they do through their nose. Now, quickly, in terms of what a structure or what part of the nose is carrying each of these functions. So first of all, filtration, and I'm typing that in the chat box so you guys can get that information. Filtration is done by your nasal hair. The second thing is moistening there. Moistening is done by your mucosa lining of the nose. So anytime you hear the word mucus, is basically slimy, right? So it's adding that moisture to your air. And the third function is basically warming up the air, which is done with a submucosa lining. Submucosa is underneath the mucus lining and rich in blood vessels. So basically, blood vessels, we already know, carry warm blood. So it's kind of like as the air passing over the submucosa lining, and the heat gets radiated up to the air and allows that air to also warm up. So these are the three main functions of your nose in terms of respiratory system functions. Now, there are secondary functions which are not as, and I'll put that in quote, as important. One is that they act as a resonating chamber for speech. So you kind of know, like if people are like hold their nose, you can see that there is a change in your voice because they allow the air to come out of the nose and basically help you with your speech. They also house olfactory receptors, which kind of makes sense. They're associated with your sense of a smell, and therefore it is important, right? But they're not necessarily, again, they play a role in terms of respiration and making sure that you stay alive. And if you never dealt with that, which would be really weird, there is a lot of sebaceous gland, which is basically oil glands on the surface of your nose. And these are basically what causes all the problems with the blackhead, the tiny blackheads and whiteheads that you may see on the surface of your nose forming over time. So there is the main reasons because they do have a high concentration of these glands on the surface of the nose. I don't know if there's anybody that knows why there is a higher concentration of sebaceous gland localized to the nose, but they are overall more in humans compared to other parts of the face. Now, we already talked about the paranasal sinuses when we looked at the skull. However, just kind of reiterating the same points as before. So you have 4 sets of sinuses. They are located and are associated with the skull bones. You can see the pictures. The most superior one is frontal sinuses, followed by the ethmoid sinuses, followed by the purple one, which is your sphenoid sinuses, and then one that are part of your maxilla bone called the maxillary sinuses. I don't need you guys to know a lot of detail about them. The only thing that I think is fascinating about sinuses is the fact that these are basically hollowed out structures inside each of the bones named after them. And they do have a mucus lining, so they do produce a lot of mucus. If anybody in our class has ever dealt with sinus headaches, they are not the most pleasant. And the main reason is usually when you have sinus headaches is either as a result of an allergy or an infection. You have a buildup of mucus inside these sinuses, and it causes this kind of what do you call it? Suctioning inside the thing. Not a suction, sorry. My God, my brain is stop working. Not a suction. What is that?
Pressure?
Not pressure. It's not. Oh my God. Maybe there is no air. What is the word? There's no air in a space. What would you call that? Goodness gracious. I literally don't remember the word, guys. That's kind of sad. When you pull a needle and then there is no air inside the needle, what is that called? When there's no air in a space, what do you call that? Come on, guys, you know that better than me. Nobody? Vacuum. Woo! Good. Thank you, guys. Thank you for helping me. So it creates a vacuum inside your skull because the mucus basically is blocking, and now you have a space inside your sinus that is basically empty of air. There's no air movement into those sinuses. And that's what creates the pain. Now, when you blow your nose and clear your sinuses, you basically get rid of that vacuum, and now you feel kind of like, oh, now I can breathe, right? Like I feel good, right? The problem is that if you really haven't resolved the underlying issue, get it be allergies or infection, that mucus is going to continue building up over time, and you're going to continue having the pain that's associated with that vacuum created by the mucosal lining. Goodness gracious. I apologize, guys. Sometimes just brain is not working. Like, I don't know how would I forget that, but all right, anyways. So now behind your nose, you have what we call a nasal cavity. So nasal cavity is also very interesting. So first thing that you see if you look at the nasal cavity is that you have these kind of 3 indentations inside the nasal cavity, and these are called conches. So they're easily named. So you have a superior, a middle, and an inferior conches. And if you actually remove the cartilage, so if you're just looking at the skull itself, where there is no cartilage for the nose, you can see parts of these conches by looking through the cavity, the nasal cavity. Now, what is the importance of these conches? The importance of these is that when air comes in through your nose and it actually reaches this space, these little kind of indentations again act like little valleys. And you know how like if you're driving in 10 and it's windy, you kind of like get stuck, especially if you're driving in Inland Empire. You're stuck between two mountains and then you have the valley, so the air pressure or the air force is significantly more. So same thing happens in your nose. So as you bring in the air and you go, as the air comes into the nasal cavity and it goes through these conches, it creates a rotation or movement or circulation. And as it does that, it basically causes the extra dust particles and material that might have not been caught with the hair nose, then they get caught within the nasal cavity. So it's another way of us to make sure that we clear our nasal cavity, clear the air from all of the dust particles before it goes farther into our respiratory system. Thank you, Kristen. Okay, anyway, so as we move forward, now we're gonna go to the back of the throat, and the back of the throat is basically what you have called the pharynx. So pharynx, or your throat, as I mentioned, is 3 parts, and we'll go take a look at this in just a minute. But the first part that is located, which is right behind the nasal cavity, right here, that's basically would be the nasopharynx. So it's the first part of the first part of the pharynx called nasopharynx because it's right behind the nasal cavity. Now, a couple of other pieces of information regarding your nasal cavity. We have 2 mucosal lining, and that's basically looking at what part of the nasal cavity. If you're looking more closer to the roof of your nasal cavity, which is somewhere up here, this is close to your ethmoid bone, ethmoid bone is right here. And if you remember, you had the olfactory foramina, the little holes that are associated with your sense of a smell. So up here, you will have basically nerves that are coming out from your skull and getting into the nasal cavity with the goal of creating your sense of a smell, which kind of makes sense because as you bring in the molecules of the smell, whatever that smell comes from, it rises up toward the top of the nasal cavity, and that's where you will have the highest concentration of your receptors for the sense of a smell, or your olfactory receptors. The bottom half, I would typically say the bottom 2/3 of that is considered respiratory mucosa, again, because it's associated with your respiration. These are basically, these mucosa are, the goal is to clean the air before it moves on to the nasopharynx. If I ask you what type of cells do you see in the respiratory mucosa, your answer should be pseudo-stratified ciliated columnar. If you guys recall, again, pseudo-stratified implies that these are fake stratified cells. Simply means that you only have one layer, but it appears as you have multiple layers. And these are long cells, so hence the word columnar. And ciliated, cilia means basically they have those tiny hair-like extensions, and they're the ones that actually, again, help with cleaning the dust and debris from your air before it moves farther into your respiratory system. Any questions so far, guys? Any clarification on anything? No? Good? Is your brain working? Maybe I should start with that question. After an exam, I know it's always hard to come back to the learning mode again. I know. But good thing that the lecture is being recorded, so you always can go back and watch this. So I like these 2 pictures to kind of show you, how time is it? Okay. Well, 45 minutes, guys. Bear with me. So pseudo-stratified ciliated columnar is depicted in 2 separate microscopy images here. The first one is just a typical light microscopy, like what you would have done in the classroom. We will have access to a light microscope. So you see these little tiny hairs that are on the surface. Those are the cilia that, again, they're moved to remove that possible debris or dust particles from your air. This is this layer starting from here to here, basically this area right here, is what we identify as your pseudo-stratified cells or pseudo-stratified columnar cells. Looking at the 3D image of this, all of these that kind of look like seaweed to me when they're underwater and they kind of have that movement. This is basically the cilia that you will see if you were looking at your lung tissue under, not your lung tissue, your nasal cavity tissue under the 3D microscopy, which is pretty cool, I think. So we talked about the nasal cavity. We also talked about the fact that the air moves from the nasal cavity to your pharynx. So this picture shows you the 3 branching or segmentation of the pharynx. Starting with the area right behind your nasal cavity, you have your nasal pharynx. Going down behind your oral cavity, so here's your mouth or your oral cavity. So the area behind that would be your oropharynx, which is the space right here. And the area that's closest to the larynx, which is these 2 larynx, this is your larynx, your 2 vocal cords are right here. This area is called the laryngopharynx. And then you continue going down, either your esophagus or your trachea, depending if you're talking about the food or we're talking about respiratory system. So in an exam, guys, if I ask you guys, write the path of air through your respiratory system, you cannot just say nose, nasal cavity, and pharynx so far. You have to show me the segmentation of the pharynx, which is, again, nasopharynx, oropharynx, and then laryngopharynx. To be able to provide that detail, that's what actually gives you your full credit for this question. Here is another picture that kind of shows you or highlights the regions that are called laryngopharynx, oropharynx, or nasopharynx. So that's about it as far as you guys need to know. Now, in terms of each of the pharynx sections, for the nasopharynx, kind of makes sense. Again, it sits right above where the food comes through. So when you're swallowing food does not go through nasopharynx, which is kind of logical. Otherwise, then the food will shoot out of your nose basically. Some people do, but it's kind of disgusting. But normally, you don't want the food to go to nasopharynx. Nasopharynx would only be limited to your respiratory system, not your digestive system. And as again, it says it's only for your air passageway. Have you guys heard of uvula before? Does that sound familiar to you guys? So if you go back to the previous picture, that little thing that hangs in the back of your throat, which is basically what, you know, when Tarzan yells and screams and they kind of zoom into the thing and it goes, kind of moves this way and that way, that thing hanging in the back of your throat is called the uvula. So when you basically eat your food, so imagine food is coming through your oral cavity, this little uvula, the little uvula is gonna move this way and basically block the passageway to the nasopharynx. So food can only basically go down and it cannot go up to your nasopharynx. But you know how sometimes, I mean, I've seen people like drink milk from their mouth and then shoot it off their nose, and which kind of is, again, kind of disgusting. They think it's a talent, but I find it disgusting. But and then I have seen people when they, you know, start to choke sometimes, like you can see the food comes out of their noses because, again, uvula basically fail to effectively remove that, move properly to cover the nasopharynx. But is it possible basically to have food in nasopharynx? yes, if uvula fails, but normally you should not have any food in the nasopharynx because it is limited for air passageway. And then it's also, again, contains the opening for what we call the pharyngeotympanic or auditory tube. You may have heard of this one. We'll talk about this when we talk about the special senses, which is your hearing. This is basically a tube that opens up from your pharynx into your ear, and that helps balance the pressure in your ear. You know how like when you are in a plane or you're on a high altitude, you swallow and that makes your ear pop? So what causes that is the pharyngeotympanic or auditory tube. It is also the tube that makes children more susceptible to ear infection. In adults, the curvature of the pharyngeotympanic membrane is more, versus for kids it's more flat. So if you have a sore throat or an infection in the throat, then it can actually travel into the ear and cause an ear infection as well. Something to keep in mind. Oropharynx is another part, again, sits or associates with your oral cavity or your mouth. The type of cells that you have is a stratified squamous epithelium. If you guys recall, again, this is basically means that there are many layers of flattened cells, and they do have, or they house 2 of your tonsils. That's all you need to know for that. I'm not going to name the tonsils for you guys, but everybody knows that the tonsils are around your throat. What part of the throat they're associated with, there are 2 of them are associated with your oropharynx. And then lastly is your laryngopharynx, which is basically a passageway for both air and food. It is the part also lined with the same type of cell, a stratified squamous epithelium. And you have, after the laryngopharynx, you will have 2 paths to take. You can either go down the esophagus, which is associated with your digestive system. So basically food continues to go down the stomach, or it can go down to the larynx, that's associated with your air, hitting the vocal cords, and again continue going down the trachea and eventually reaching your lungs. And I just want to show you the picture on this one. I already kind of discussed it earlier, but going back to this picture, again, you have 2 tubes. The front one, as you can see, is wide open. This is your trachea, the passage for your air. And then the one that is more narrow, which is people typically say, oh, for food particles are bigger, so the bigger passageways for the food. That's not true. The posterior one, which is actually more narrow, it's highly muscular. That's your esophagus connected to stomach. The wider tube that is more anterior, that's your trachea or your windpipe. And that's the one that goes to your lungs. And if you want to remember this one, kind of imagine, you know, in the movies, or if somebody is choking or being, not choking, sorry, being strangulated, right? What you're cutting, if you're putting pressure here, right, you're cutting their air passageway. You don't care about food, right? So when you put pressure here, right, you're cutting the air passageway, not the food passageway. That means that the trachea is anterior or in front, and then the esophagus is in the back. Any questions, any clarification, guys? Okay. So let's move on to the next part of our respiratory path, which is your larynx or your vocal cord, or your voice box, I guess I should say. The main function of the larynx, as we have mentioned, is basically production of sound, which makes sense. The second one, it's part of the passageway for your air, right? So if you want to basically bring in air during inhalation or getting it out during exhalation, you need larynx, or you need to pass through the larynx. It also has the capacity to separate the route of food versus air using this little flap, and I'll show you just in just a second, that is called the epiglottis. We have heard of it before when we talked about the cartilage tissue, but now we're going to take a look at it in a little bit more detail in terms of function. So most of what we consider larynx is actually cartilage tissue, which is what you can see depicted in the blue colors in the three images. So first of all, let's take a look at the viewing that you have. So you have the viewing, which is the anterior view. So they're showing you right here, this area right here. The second picture is basically showing you the larynx in the back with the connective tissue and all of the ligaments. And then the third one is just showing you the back view or posterior view without any of the ligaments. So just the 4 cartilage sets. Now, one of the first things I want to mention, which is kind of help you guys connect the point, is that the largest cartilage, if you look at this picture, is a cartilage called the thyroid cartilage. Okay, so thyroid cartilage is close to your thyroid gland, hence the name and the relationship between the two. So in males, because of the high level of testosterone, the thyroid cartilage grows larger than in females. So what we identify as Adam's apple in male, right? The little thing that moves up and down in the neck area, that's basically your thyroid cartilage that has been enlarged because of the high level of testosterone. Right beneath that, or inferior to that, you have another cartilage called the cricoid cartilage. So cricoid cartilage almost completely go around to form a kind of a circle right underneath the thyroid cartilage. And then you have 2 smaller cartilages which are related to your vocal cords and basically help move your vocal cords, called the arytenoid cartilage and the corniculate cartilage. I know it sounds like a lot of vocabulary. So here is a view on the top. So if you're looking at this view, basically I'm looking at the top view of the larynx. Again, here is the front, here's the back, and again, I'm looking at it from the top view. So here is the biggest cartilage, as I mentioned, that's your thyroid cartilage. Then they have the circular cartilage right here, which is your cricoid cartilage. And then these 2 that are actually gave it the bony color, but they're actually cartilages still, you have 2 of them. The one that is holding the vocal cords, actually connected to the vocal cords directly, is referred to as the arytenoid cartilage. And then the really tiny ones right here, these are called the corniculate cartilage, and you have 1 on each side. So you can see that these 2, again, these 2 strings are your vocal cords. And by movement of the cartilage, you can actually either open up the vocal cords to open up a gap right here, or again, close these 2 cartilages to bring the 2 vocal cords in a closed position. So if you look at it in the image below, these 2 lines, again, these 2 red lines that you see right here, or pink lines that you see right here, these are your 2 vocal cords. See the position, or the gap is very small between them, so that's the closed position. And then this is the open position when the 2 vocal cords are far apart from each other, so you have a larger space between them. Now I keep referring to this as a space. This space actually has a name. It's called Glotus. So basically this opening you see right here, this wide opening at the center, which is shown right here as well, this is called the Gluteus. So this is when the, if you think about it, and I think I have a picture here. So here is the real vocal cords. Right here is 1 vocal cord, right here is the second vocal cord. See how the space is really small between those 2 vocal cords right here? That's your gluteus, that really black area right between them, that's your gluteus. So when the two vocal cords are really close together, your glottis is basically closed. When your vocal cords are apart from each other, that's basically your vocal cords big apart, and that causes the glottis to be open. It is spelled right here in your PowerPoint, right here. Not epiglottis. This is not the same thing as epiglottis, guys. This is just glottis. Glottis is literally the space, the opening itself. Epiglottis, as I'll talk about in just a minute, is the cartilage that protects the glottis, okay? So epi means above, right? Or on top of. So glottis is the space. So if you look at my hand, this space between my hand where the air is basically getting in and out, that's the epiglottis. So right here, basically air is getting in and out. Now, if I have this flap right on top of this, which is my other hand going over the thing, that would be my epiglottis. Epiglottis is open, air can get in. Epiglottis is closed, no air can get into your air passageway. Hopefully that makes sense. Is this making sense to you guys? Any questions about this? I know somebody came in late, so please make sure you type your name in the chat box to make sure that you get marked as partially present. So you can message me directly. I don't really care as far as your name is on the chat box. Okay, so here is another view basically. Here is basically your thyroid cartilage. That's your arachnoid cartilage right here. And again, if you're looking at it from the top view, those would be your two smaller cartilages that are basically holding your vocal cords in place. Now, I haven't, let me go forward. I just want to make sure I don't have a slide for it. So look at, this is your epiglottis, right? This is from the posterior view. But let me show you going backward in an image that we have right here. So here is your epiglottis, the flap that I'm talking about, guys, right? This is your flap. So here is your larynx, right? Which continues going down your trachea, which is your air passageway. Or the other passageway that you have is for your food, which is your esophagus. So pay attention to this. When you are breathing, so either bringing air in or taking air out, or inhaling or exhaling, what I do want to have is my epiglottis to be in an open position, right? So I don't want it to cover up my larynx, because if it's covered up, the air cannot get in and out. So I want my epiglottis to be in an open position and my glottis to also be open. So basically I have two gates and I want both of those to be open. When I'm eating, what I want to do is I want the epiglottis, the little flap that you see in blue, to come and cover my larynx. So when I'm eating, I want this flap to come and cover my larynx. So basically, as food comes down, I don't want the food to go through my trachea. I want the food to go down my esophagus, which is the path for my food. So here's the thing. If you are talking or breathing, epiglottis wants to be in an open position. When you are eating, you want your epiglottis to be on a closed position. So you have heard of this saying that says, don't eat and talk at the same time. What does that exactly do is if you do talk and eat at the same time, your epiglottis for most of the time can manage when to stay closed and open. So you can do both the talking, the breathing, and eating at the same time. But sometimes epiglottis gets it wrong, and that causes basically choking. So yes, exactly. So you can choke as a result. So don't talk and eat at the same time. So let me add another piece, and then I'll type this in the chat box so you guys have that information as well. So what creates sound? This is already on your PowerPoint, but I just want to kind of point it out again. So what creates the sound is when you bring in air into your respiratory system, okay? Your glottis is in an open position, so air can come inside your air passageway. When I want to talk, or when I want to create a sound or voice or whatever that has to do with our speech, what I want to have, pay attention to this, guys. I want my two vocal cords to be close together, like what you see on the top image. So what I would have is this tiny, tiny gap between my two vocal cords. So they are almost in a closed position. So as the air is gonna come out of my lungs, it's gonna try to do what? Pass between the two vocal cords. Now, because the space is so small, as it's trying to rush through that space, it's gonna cause my vocal cords to vibrate. And that vibration is what creates the sound. So when I ask you, if I ask you guys in an exam, what is the position of your vocal cords when you are breathing? The vocal cords are open. When I'm speaking, my vocal cords are in a closed position. So that causes basically, again, as the air is coming up my lungs, it's gonna cause the air to kind of try to rush between my two hands or my two vocal cords, and that causes the vibration. So you know when somebody talks a lot and they don't take a breath, they say, take a breath. Because when you're talking, what are you actually doing? Getting air out of your lungs, out to hit the vocal cords to create the sound. So you need to, again, fill your lungs with air so you can continue talking. It's a good quality if you are a singer, though. So, so let me type these things for you guys in the chat box so everybody has the information. So, and it is already on your slide, in the slide that you're looking at right now, but I'm just gonna kind of put it in my own terms so you guys can have that information as well. So glottis is in an open position when you are breathing to allow air either enter or exit the lungs. When creating a sound, the vocal cords are close to each other and the gap or the glottis is very small or closed. So as the air comes up the air passageway, which in this case is your lungs, it rushes between the small space and causing vibration of the vocal cord to create sound. So that's one concept we talked about. What is the position of the glottis / vocal cords when you're breathing or when you are speaking? The second thing that I talked about is about epiglottis, the little flap. So when breathing or talking, the epiglottis is in an open position, which basically means not covering the glottis / larynx. So air can enter / exit respiratory system. When eating, epiglottis Epiglottis is in a closed position, which basically means it's covering the larynx to make sure the food can only go down the esophagus and not the trachea. So not a good idea to, again, to eat and talk at the same time, because it can cause confusion for epiglottis and cause choking, basically. Is this making sense to everybody? Is there any questions regarding that? By the way, same thing goes for laughing, guys. Laughing and eating. Laughing also puts the epiglottis in an open position, so you should not be doing laughing and eating at the same time. It can cause the same confusion. Awesome. Okay. So the next structure we have in our respiratory path is our windpipe, which is also known as the trachea. So one of the most important characteristics of trachea is the fact that this tube always remains open, so it doesn't collapse. It's not like esophagus, which is highly muscular, and as food passes through it, it kind of opens up and closes to push the food through. Trachea is always stays in an open position and basically doesn't collapse on itself. The reason that it has that capacity is these blue rings that you see. They actually, if you look at it from the top view, they shape like a C ring, like here is the C, or horseshoe if you want to call it. That's the cartilage, and they are called hyaline cartilage rings. Okay, so again, the blue structures that you see here versus the same thing here from the superior view. The number of these cartilages may be different depending on the size of the individual. They're usually between 16 to 20 per person. And again, the goal of this cartilage is to make sure that the trachea always stays open, basically regardless of the condition. So you want to keep that open at all the time. So the other characteristics that your trachea has is at the end of your trachea cartilage, or your hyaline cartilage, if you want to say, you have this muscle that connects the end of your C together. So what you see in pink is called the Trachealis muscle or tracheal muscle. So what is the goal of this muscle? So this muscle is a smooth muscle that basically controls the size of your trachea. So if you look at my finger and kind of look at this is the C, and then think about the space between my finger is the muscle. So if I bring the muscle and contract it, the two ends come close together and it makes the opening smaller. And then when you are basically want to bring a lot of air into your air passageway, you want to relax the smooth muscle so the air passageway opens up, and that means more air has the capacity to come in. So by using the trachealis muscle, I can adjust the size of the trachea and therefore adjust the flow of the air in and out of my lungs, which is pretty cool. So that's all you need to know for trachea. It's pretty basic. So what is the path of the air after your trachea? So that's where you actually start to get into your lungs. And again, this is where your conducting zone starts, where you're actually thinking about, I'm going to gas exchange, I'm going to allow the oxygen to get into my system and carbon dioxide to be removed. So the conducting zone is basically your bronchial tree. And I know there's the same listed 7 structures. It's really easy to remember because they kind of go primary, secondary, tertiary, at least for the first 3. So one thing that you do need to understand is that these bronchial tree are very extensive. They expand throughout the whole lung. And again, their goal is to basically use every corner and crevice of the lung to bring in oxygen into your lung or bring in air into your lungs. So the trachea, which was the big windpipe that comes down, is going to start to immediately branch as it comes into your lungs. And that branching is called the primary bronchi or main bronchi. Bronchi, by the way, is the plural version. If you're talking about one of those, it's called bronchus. So bronchi is when we talk about both lungs, like basically left lung and right lung. But if you're talking about one of them, it's just called bronchus. Now, as it comes in, it starts to branch, form a smaller branching. So those branching are called secondary bronchi. A smaller branching, tertiary bronchi, and I will look at it in a little bit more detail in just a second. Then you get to these really small branches called bronchioles, which basically means little bronchi. Going to terminal bronchioles, respiratory bronchioles, alveolar duct, and eventually your alveolus or air pockets where the actual gas exchange takes place. And again, this is just kind of an overview, so we're going to go into more detail about that. So let's look at the first branching. Primary bronchi, which is also known as the main bronchi, is the largest bronchi. That's the actual branching from the trachea. So here's my trachea again. This is my trachea. And these branching that you see are your primary bronchi. So these are the first branches. One thing that you guys do need to know about them is that the right main bronchi, so the right side, this one, is actually wider. So the opening of the bronchi is bigger and it is shorter. So when I compare this bronchi here versus this one, there is a difference in them. The main reason that different exists is because of your heart, okay? Remember cardiac notch we talked about last time, where your heart basically pushes, or the apex of the heart pushes into your lung? So that's your cardiac notch right here. This is your cardiac notch. That makes your left lung to become smaller. So your left lung is smaller. So right lung is bigger, so it has a wider air passageway to allow more air to come in. And because basically the heart is not pushing into it, it doesn't need to be as long. So because of the heart is mostly on the left-hand side, we need to extend the primary bronchi a little bit farther so it actually reaches the lung. Now, another thing, by just looking at the picture here, guys, for your lungs, one other feature that is really clear is your right lung, this one, compared to your left lung, has different number of lobes or sections. So your right lung has 1, 2, 3 lobes, and your left lung only has 1 and 2 lobes. The name of these lobes are superior, middle, and inferior versus superior and inferior. Why is that matter? When we look at the secondary bronchi, so primary, secondary bronchi, each of the lobes of the lung gets its own bronchi. So look, Secondary or lobal bronchi is basically one per lobe of the lung. So if you have 3 lobes on the right, you will have 3 secondary bronchi. And if you have 2 lobes on the left, then you only have 2 secondary bronchi. So again here, 3 on the right and then 2 on the left, which again kind of makes sense. Tertiary is starting to basically form many branches. So it's not as organized as what you see for the primary and secondary. You just continue forming smaller branches. They're also called segmental bronchi. So tertiary also known as the segmental bronchi. Then you get to the really smaller branches. They're almost going to be invisible if you're trying to look at them with the naked eye. So they're, again, relatively small, 1 millimeter. Terminal bronchi is the next step. So these are the smaller branches, about half of the diameter. Respiratory bronchi is about half of that. So they're basically getting smaller and smaller as you go through them. And then you eventually end up with what we call the alveolar duct. So I'll just want to show you this. Here is the terminal bronchi again, respiratory bronchiole, and then alveolar duct. And then at the end of the alveolar duct, you have these tiny air pockets, which we identify as alveoli, if you're talking about all of them. And then if you're just talking about one single of these, they're called alveolus, with again, US at the end, instead of an I at the end. So if I ask you guys, what is the path of air through the respiratory system? Okay, you cannot write this as, let's say, bronchial tree, okay? You have to give me the detail. So I'm gonna give you that detail to make sure everybody's on the same page. And then that is something you need to know for your exam really well. So start with your, I'm gonna just number them for you. Your nose, nasal cavity, your nasal pharynx, right, which is the first part, oropharynx. Hopefully they're not going to get autocorrected. Laryngopharynx. And a lot of people forget, because they say laryngopharynx, they forget to put larynx in there, but larynx is still in a structure. Then you have your trachea. You have your primary bronchi. And you can also refer to these as you can't type. Primary bronchus, that's fine, but I just use the general version. Secondary bronchi. Oops, bronchi. And then tertiary bronchi. That's my number. Bronchial. Terminal bronchiole. Respiratory bronchiole. I apologize, sometimes I misspell and click without a spell checking, I guess. Alveolar duct, and then eventually alveoli. So please do note, if you just write bronchial tree, that's not an acceptable part. If you just say pharynx, that's not an acceptable answer. So you have to show the path that I've drawn for you guys here. If I'm asking you, write the path of the air through the respiratory systems. This is what I want. You cannot just simply say trachea, lungs, and then you're done. No, lungs are actually the structure that holds, or the organ that holds the bronchial tree. So what I want to hear is the bronchial tree itself, not the lung, just as a general term. If you were like, I guess, 6th grader, then I would accept the lungs, but everything else, you have to list them. It's supposed to be bronchi, as I said. It's just misspelling. Sorry. So number 9 is secondary bronchi. I don't want to retype it because then the order gets off. So one last thing I want to finish with is this a slide for your lungs. I have already mentioned that the right lobe versus the left, your right has 3 lobes and your left has 2 lobes. We already looked at the naming as a superior, inferior, middle versus superior and inferior. There's a couple of things that I want to add on top of that. First is that if you look at your lungs, you have again that pointy aspect of your lung right here, right here. So that's called the apex, kind of like your heart, you had the apex and the base. Same concept applies here. So you have the apex on the top for the lungs and the bottom where it sits on the diaphragm, that would be your base. If you look more of the medial aspect, so if you kind of turn the lungs slightly outward and look in where the blood vessels and where your primary bronchi are coming into your lungs. So basically this space right here and right here, this is referred to as the hilum. So hilum is the area where either blood vessels or your bronchi enter or exit your lung. And then the last thing that I want you guys to know is the separation line that forms the lobes of your lung. So the separation line between the superior and middle lobe, right here, superior and middle lobe on the right, is called the horizontal fissure. So this line is the horizontal fissure. And then the one that comes in an angle and separates inferior from the other two is called the oblique fissure as an angle. I think there's just a misspelling here. It's not obliquan, it's just oblique. And then on the left-hand side, you only have 2 lobes and the separation line is just a oblique or oblique fissure. And fissure simply means a big cut, a deep cut that literally separating the organ to little pieces. Another thing that I mentioned prior is the cardiac notch, right? The little indentation on the left where the apex of the heart sits. Okay, so I'm gonna stop the lecture here. Let me stop the recording before I forget.